Medicine, religion, and spirituality share a long history, as evidenced by the roles of healers such as priests and shamans. This is only natural because history tells us that ancient civilizations believed diseases were sent by gods or devils. For centuries, medicine was a profession attending to both body and spirit, with patients often viewing physicians as secular priests who help them grapple with the spiritual aspects of their illness. Historically, many hospitals were founded by religious organizations and espoused values of compassionate service. As medical science and technology evolved, contemporary physicians no longer saw it as their role to care for patients' spirits. And the advances in medicine in the beginning of the 20th century resulted in eliminating the humanistic and spiritual aspects of patient care. From that point on, physicians and health practitioners have been educated to look at the physical body as the sole cause of illness, completely neglecting the whole of the spirit or the spiritual dimension of whole patient care. By the late 20th century, there was a greater outcry from the public for more holistic and spiritual approaches to medical care. While more medical professionals are beginning to recognize that spirituality is a core patient need and has beneficial influences on health, some in the medical community think it conflicts with medical science.
The research indicates that people who are more religious, those who are more involved in their religious communities, are healthier, have better mental health, have better physical health, and tend to live longer as well.
According to the 2013 International Consensus Conference on Improving the Spiritual Dimension of Whole Person Care, spirituality is defined as a search for meaning, purpose, and transcendence, and a connection to the significant or sacred, and it can be expressed through beliefs, values, traditions, and practices. So, by this definition, spirituality is an inseparable aspect of humanity. The content and the basis of spirituality in medical courses have changed from 1992 to the present. Initially, courses responded to patient need as demonstrated in surveys. Then, it began to emphasize the clinical aspect of spirituality, and more recently, began to integrate the spirituality of the clinician as a way to help students identify with their role as healers. Given that, 1, spirituality is associated with reduced mortality and risk for certain diseases, 2, there's a growing number of patients with chronic conditions and suffering, and 3, physician burnout is increasing. Thus, spirituality is both relevant and timely. Requiring spirituality as an integral component of medical education would bring medicine closer to the World Health Organization's long-standing definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We cannot serve our patients well if we only focus on the physical aspects of their illness, and neither can we rely on other members of our team to take care of the psychosocial and spiritual issues as ancillary luxuries. The core element of the healing relationship is our ability to adequately address all the concerns of our patients and their families, psychosocial, spiritual, existential, and physical, and to work in partnership with experts in each of these domains. Anything less than this is both inadequate and unethical in meeting our professional obligation to our patients and their families. And the goal of the Spiritist Medical Association is to promote the integration of spirituality in the practice of medicine, as we believe that spiritual well-being plays a key role in prevention of diseases and in the healing of those who have become ill. Let us gear up to discuss these vital topics as we welcome you to the 7th U.S. Spiritist Medical Congress, integrating spirituality in clinical practice.